Right, welcome. So we're excited about this town hall meeting. And what we hope to do today is just share some updates and also take some time to get prepared for the meeting coming up around the corner in Prague. So very excited. Okay, so we'll review our current professional community leadership group and incoming members. We'll review membership statistics. We'll look at highlights for the community for our conference, session highlights, meetings, and then pre-meeting day academies and our Bridging the Gap program, so that we're making sure people have the opportunity to register and plan their travel accordingly if they are going to join those. For planning for 2025 symposium proposals, we want to get an idea what people are interested in and figure out the best way to share that information. We're going to give updates on our standards and guidelines documents and talk a little bit about future webinar ideas and JHLT open special issues. And then we're going to leave it open for discussion. Okay, so this is our current leadership group. I'm Meg. I end my term, sadly, after Prague. I'll pass the baton. Edith is currently with us until 25. Colleen is also ending her term after the meeting. Elsa continues. Brittany continues to next year, and Christiane and Sarah are on our leadership advisory forum. Taking over for me will be Kate Hughes, who I think is on the call from Vanderbilt, and then Thomas Schlaghofer from the Medical University of Vienna. And hopefully I did okay with his name. I don't know if he's on the call, so don't anyone tell him I messed his name up. Okay. All right, let's talk a little bit about our professional community in relation to ISHLT as a whole. And I think this is a really helpful slide to see kind of the breakdown. And we're in one of the largest groups, really. If you look at it, pathology is 1%, ID 2%, anesthesia, critical care 3%. Oh, thank you, Brittany. 4% research and immunology, 4% pharmacy, peds 8%. We're at 9%. And then next, pulmonology, CT surgery, cardio, and then other, which may be board members. I'm not sure what that one is. Okay. All right. And so let's look a little bit at the professional community's membership trends. So as you can see from 22 to 23, Nursing Allied Health had a pretty significant increase in membership, as did many of the other groups. And I think we can attribute that probably to the new membership dues structure. Okay, this shows us a little bit about Nursing Allied Health representation in each IDN and ECT compared to the overall. And we are represented in every group, and we are a significant part of our IDNs. And I think this says a lot about our ability to make change, to have a voice, and it really speaks to the collaborative practice that we have at ISHLT. So this is looking a little bit at, again, the new dues structure. And so this is looking at trainee, non-physician, middle low, non-physician high, physician middle low. So most of us in Nursing Allied Health probably fall in that non-physician high. And you can see there's a considerable increase in our membership. And I think really having the financial barriers addressed and bringing those membership fees down is really allowing more of us from Nursing Allied Health to participate. So this shows us a little bit about where our members are from. And as we know, the majority of our membership is North American, but we are starting to have more membership that is non-North American. And I think we need to certainly encourage that. And it's really helping us to have a better sense of what our colleagues across the world are experiencing. This is a reminder about ISHLT Connect. And we are all available or have available to us the ability to use Connect to communicate. And it really is a great way to, I think, get information about the society as a whole, as well as PCIDN specific. And it's something that we would really like to see utilized more as a means to really stay connected and updated and share knowledge. So we can talk a little bit about the professional community and IDN meetings in Prague. As you can see, they are timed so that you are able to go to your professional community meeting and you don't miss your IDN meeting at the same time. And allows us to really be able to participate in both those meetings. So that looks like the primary IDN meetings are during the day, Thursday and Friday, and then the professional community networking meetings are in the evenings. So a little bit about our professional community webinars. You can see past webinars and webinars coming up. Our Nursing Allied Health webinar is next Thursday at 3 o'clock Eastern. And we'll talk a little bit more about what the content is. Here it is. Forming a patient family advisory council to improve outcomes and patient satisfaction, a center-specific experience. So this is actually our experience from Inova Fairfax. So it'll be myself and one of our nurse coordinators and two of our patient family advisory council members that will be speaking, and Brittany and Colleen will be moderating the session. It's really, I think, a really great initiative, and it's a way for patients and families to be more involved in their centers and really allow us to understand what their needs are. So I'm really looking forward to sharing our experience on that.
Great. Thanks, Meg. I'm really excited for that webinar too. I think it's going to be great. It's not being done at a lot of centers, but I think something that a lot of centers are interested in doing. So I'm really excited to learn from your experience and how you got that started. And then I'm really excited to hear from the patients about their experience in this and how it's benefited them and how they've kind of gotten involved to make improvements. So we're excited for that for next Thursday. The next thing we wanted to talk about was these S&G documents, so standards and guideline projects. And you may have seen an email circulating around asking if you would be interested in participating in any of these guidelines or consensus statements. So hopefully some of you filled out your interest and participated in this, because remember, in ISHLT, kind of with everything that we do, we're looking for that gender, geography, and generation. But the other thing that we want to look at is to make sure that all of our professional communities are represented in this. So I really hope that we can get nursing and allied health on each of these projects. And we specifically wanted to highlight two that nursing and allied health put forward and got approval for papers in the near future. So the two are the ones in red here. The first one being this engagement of social support systems in patients being considered and for and following advanced heart and lung therapies. And this will be a consensus statement, and we're really excited that Colleen's going to be leading this one for us. And then the second one that we're going to be working on over the next year is palliative care in patients prior to or following heart transplant, lung transplant, or mechanical circulatory support. This will also be a consensus statement, and that's going to be led by Rebecca Coleman, who is a physician, but then we have some nursing and allied health members who are going to be co-leads. So Christiane and Melissa will be co-leads on that. And Colleen, I wanted to ask, I know the call for participation in these has closed in the last week or two. And have you been given any details, or does anyone on this call kind of have details about what it looks like moving forward? So the leads, I think, get a list of people who are interested. When should people expect to kind of hear back about whether they're going to be part of that writing group?
I actually don't have any additional information beyond what you just said. So I don't know if anybody from ISHLT has
I think we've
more
been
updated
notified.
info.
I think we have been notified for those of us that have been, for the one that you're leading on, Colleen. I think I was sent names of 4 or 5 people, of which I'm one.
Okay, great. So I guess maybe some of those notifications are going out. Greg, do you know anything more about that process?
I'm checking right now.
Perfect. Okay, we'll circle back with you if you uncover any more information for us. But hopefully we'll have an update on that soon. But just keep a lookout, if you did volunteer to participate in something like that. Okay. The next thing we kind of wanted to highlight is for those who are going to be going to Prague to the annual meeting, wanted to highlight some of the nursing and allied health sessions that you might be interested in attending. Sometimes it's, especially if it's your first conference, difficult to kind of navigate where to be. So we wanted to make sure that you knew about these particular ones. On Wednesday, there's going to be an interesting session called Surviving and Thriving After Cardiothoracic Transplant. And this one's going to really address kind of the psychological challenges for patients and caregivers after transplant, and then novel strategies to kind of optimize well-being and their overall quality of life. And many of the speakers in this session and also the moderators are nursing and allied health. So that will be a great session. And then that afternoon, there's another session called A Touch of Gray. It's Aging and Biology and Holistic Clinical Care in Cardiothoracic Transplant. And really that one's going to focus on what we're seeing in clinical practice, and that's that we're seeing more older adults who are undergoing transplant. So it's going to talk a little bit about, how do we evaluate older adults? How do we make decisions about their transplant candidacy? And kind of what are the special considerations in managing their care after transplant for both the patient and the older adult caregiver. So that's going to be a great session too. On Thursday, there's a few sessions that we wanted to highlight in the afternoon at 1:15. The It's a Wonderful Life. That session's really going to focus on behavioral and psychological supportive strategies that can help both pediatric and adult transplant patients. And then at the same time, at 1:15, there is going to be a session that the Early Career and Trainee Committee is running. And although it's kind of geared towards early career, I think the topics in this session really could apply to anyone. It's really going to provide an overview of advice for early career professionals as they start their careers, but also how do you take on leadership roles either locally or within the society here? How do you become teachers and mentors, and kind of how to navigate that work-life balance, including parenthood, while also trying to avoid burnout. So I think that's applicable to many of us. So that should be a great one too. And then that afternoon at 3 o'clock, there's going to be a patient-centered outcomes after lung transplant session. And this is going to include research abstracts that kind of extend beyond the clinical evaluation criteria and discuss criteria that us as nursing and allied health are often responsible for, including looking at health literacy and grit and resilience and frailty and exercise capacity and palliative care in lung transplant recipients. So that should be a great one. And then Thursday night, as Meg pointed out, will be our nursing and allied health PC networking event that we'll have. And then on Friday, two more sessions we wanted to highlight. It's all relative. How much is too much for heart and lung transplant patients? So this is really going to focus on and review relative contraindications and challenges that we face. And so we'll think about how do we consider transplant in different scenarios. So thinking about multi-comorbidities, prior substance abuse, transplanting patients off ECMO. So things that, we're seeing in clinical practice a lot. And then the last one I wanted to highlight is going to be Friday afternoon, and that's going to be psychosocial and developmental considerations across the heart transplant lifespan. So it's going to be looking at issues like adherence and transitions of care and quality of life. So lots of great sessions that are happening, and they're kind of spread out over the entire conference. So we're excited for these. I can get, there we go. Okay, so then some coming soon, and I'm gonna let Meg talk about this first one here, this collaboration with ITNS. So go ahead, Meg.
Sounds good. So we're really excited to collaborate with ITNS on a virtual conference with a tentative date of July 13th of this year. ITNS was not putting on an in-person conference this year, and we figured since not all of our nursing allied health colleagues would be able to travel to Prague, it was the perfect timing to put a virtual conference together that would allow us to partner up, offer sepsis and bring some really good content to both groups. And I know many of us are members of both ISHLT and ITNS, so it just seemed like the perfect partnership. So that is in the works, and more to come on that. And then, as we mentioned before, our Nursing Allied Health webinar is next week. And then don't forget to register time for sure.
Perfect. Two other things I wanted to highlight for the meeting. One thing, obviously, yes, register for the conference. The other thing is if you are a first-time attendee, there is a breakfast, but you also need to register for that. I'm not sure if it's open yet, but I know that's something that fills up very quickly. So if you're interested in that, take a look into that. And the other thing is the Early Career and Trainee Committee for the first time last year, kind of hosted this event called Meet the Experts. And so early career is considered anyone within their first 6 years of practice or first 6 years within transplant. And that Meet the Experts was kind of this informal thing where there were experts on different topics, and it could be clinical topics or research topics or work-life balance. We're kind of working on what those topics will be, but there were experts kind of at these high top tables, and it was just this informal area where you could walk around and kind of just talk to different people. There were cards on the table of like questions you could ask the expert there, but it was really cool. I participated in it last year, met a lot of people. It was easy to talk to people and to network. So if that applies to you for early career, feel free to join us. And I'm not sure if it's going to be on Thursday night or Friday night for that. I'll have to keep a lookout for that. So then our last thing here,
could I maybe say one thing, Brittany?
Sure.
Maybe this would be a good opportunity also for ISHLT Connect. So if you're a brand new attendee, maybe post something on there and you could see who else might be attending and get phone numbers or contact information in advance to meet up for coffee or networking in between sessions. I think that's one of the most valuable things about the meeting as well, is the content plus those connections.
Absolutely.
And just to clarify quickly, the Meet the Experts events is actually on Wednesday.
There we go. Great, thank you. That's actually helpful. We had it Friday last year and realized it would be nice to have it on Wednesday for people to network and then be able to kind of continue to work on those relationships throughout the rest of the conference rather than meeting people on the last day. So that's awesome that it's going to be on Wednesday night, and that won't conflict with our PC networking event then too. So awesome. So then our last thing that we kind of wanted to talk about, and this is going to be more discussion based, is we wanted to hear from you if you have any ideas about symposium proposals for 2025. I know it's early to start thinking about that. Also kind of wanted to talk about, in the past, we have offered sessions to kind of work with, to work together on developing symposium proposals. So maybe we wanted to think about what the best time for that is in terms of a time frame. Also wanted to hear from you about whether you have ideas or would like to see certain topics represented in future webinars. So we'll kind of open it up from here. I'm going to stop sharing so that I can actually start to see people here.
Before we jump into those things, Megan has joined the call, so we can talk about the S&G documents. I know there were questions about notification and timing and such.
Yes.
Yeah, if y'all
go ahead.
Go ahead.
No. I was just going to say we had presented the consensus documents that will be worked on in the next year and mentioned that the call for participation has closed. So we weren't sure what happens from here in terms of when will people be notified, whether they've been selected.
So we actually were concerned about this as well. And we made a note that you had to check the box at the bottom of the application, the volunteer application, that said you may not be notified for a while. Just so everybody was kind of clear on that, because what's going to happen is the project leads will go through and they will put together their writing committee, and then it has to go through approval by SNG and publications oversight. So the whole application has to be approved with the writing committee members before anybody will be notified.
Okay, so it might not be for a while.
Yeah, and like I said, we tried. Maybe we can do that better next time
I do
around.
remember that now that you mentioned that. I do remember it saying that. But that's helpful. Okay, was there any other questions people had about SNG documents now that we have Megan on here?
Hi, it's Angie. I just wanted to know, how is it determined who is going to be participating in the documents for the invitation to be sent in the first place?
So that is up to the project leads. SNG's input is limited to looking at the diversity for the most part, and to make sure all of the PCs and IDNs that are appropriate are represented on that writing committee. But the actual names of the contributors are strictly determined by the project leads.
Okay, thank you.
I'll make a note of everybody in the chat who said they're interested as one of the project leads for the engagement of social support systems with Colleen.
I think maybe this just speaks to something we've talked about before, and I think we're getting better at it, right, Meg, of people identifying their strengths and sort of having, you know, Brittany, we sent out information where people could kind of talk about that a little bit, because I think that that's the only way we're going to know what people can do, or what, you know, expertise and strengths people bring. So I don't know how that project is going, or what your response rate was on that, or if you feel that that is more robust, because we were kind of mimicking the pharmacy group and what they had done. Do you feel that that was successful, and that you now have a lot of idea of people's expertise?
That's a great question. So we did send out a survey, I think it was last June, with some questions about, you know, we sent it to Nursing and Allied Health about, you know, what is your experience level? You know, what is your profession? Are you a nurse? Are you a physical therapist? Are you early career? And then had kind of all these topics where you could check off whether you have interest in. So I think it was, I forget the exact response rate that we got, 50, 60 maybe people. And our, you know, our group's about 250. So I think we could promote it better in the future, but I am starting to think about, and I think we'll probably talk through this, about how we could revise that survey a little bit to learn a little bit more. Serving on program planning committee, what I found was difficult was someone would check off they have an area of interest, but it's kind of hard to determine whether you have expertise in that area or interest in that area to like promote someone to be a speaker for something. It's like there's a difference between I'm interested in that area and yes, I'll stand up in front of 500 people and talk about it. So I am involved in some other societies, and I've seen their survey they put out. And so I think as a group, we could think about how to adapt that to kind of learn a little bit more about where your level of interest is. So I think it's a really good step forward in terms of learning who our members are and where they're working and what their interests are. And I think we can continue to work on that and develop it a little bit further to make sure that Nursing and Allied Health is represented on all these different things that the society is doing.
Yeah, I agree. I also think, though, it shows you a level of engagement. I think if somebody is going to go through the process of completing that form and submitting it, then they're engaged and they want to participate. So I think it's really important to acknowledge those individuals who do make that effort and do that. And those are the people I think you want to try to pull in. So I just want to put that out there. And I agree with you. There are probably many different formats of how you can get to that information. And if I were to see someone who had an interest and you maybe wanted to include them in something, then yes, I think that's that's where the conversation starts. But it's like, okay, what's your level of expertise in that particular field? But I think for the 50 people that filled it out, we at least know they have an interest in this society and this, you know, are trying to network and be engaged. So I think it's just important to acknowledge that in some way.
Yes. So anyone who didn't fill it out so far. I think we've posted that on ISHLT Connect, so you can go back and look at that post and fill it in. You know, we're continuing to collect that data. And then if we decide to change the survey or anything, we will resend that out. But I think it's something we should send out yearly, so that, you know, new members are aware, and members who maybe have missed it in the past still have the opportunity to sign up and kind of contribute their information.
Yeah, I think we can bring that up at the meeting as well, just as a reminder.